Hi, my name is Kenzie Klee, a nursing student here at the University of Michigan. I'm here to present a patient to you today. Patient is 74-year-old married Caucasian female. Her date of birth is 2/13/42 and was formerly a registered nurse. Patient came in with a chief complaint of right shoulder pain. Her vital signs are as followed. Temperature 97.6 degrees, taken orally. Respiratory rate 16 breaths per minute. Heart rate 82. Blood pressure 128/84, and her pain is currently a 4. History of present illness. Patient said that pain started 9 months ago from overuse. Patient described it as an achy, intermittent pain that worsens during ADLs such as household chores, bathing, dressing, and driving. The patient also noted that the pain worsens and numbness and tingling is present at night. Patient takes 500 milligrams of Tylenol once daily for the pain and finds ice, heat, and rest to help alleviate the pain. She also attends physical therapy 3 times a week to help strengthen the shoulder and reduce the pain. The patient's perception of the problem is osteoarthritis. Past medical history. Childhood illnesses include measles at 6, pneumonia at 9, mumps at 10, and chickenpox at 12. These childhood illnesses suggest a lack of immunizations as a child. At 48, patient was diagnosed with hypertension. At 58, osteoarthritis, and at 62, high cholesterol. 1 year ago, at 73, patient was diagnosed with dermatitis, and in July of 2015 had a basal cell cancer removed. Patient is up to date on all her immunizations currently. Patient states no allergies. Past surgical history includes hysterectomy in 1989, a right total knee replacement in 2004, and a left total knee replacement in 2009. And then, in 2015, she had a Mohs procedure done on her left cheek. Her current medications include 120 milligrams of verapamil twice daily by mouth for her hypertension. And she also takes 20 milligrams of Simvastatin once daily orally for her high cholesterol. In addition, she takes 500 milligrams of Tylenol as needed for her right shoulder pain, and has lotion betamethasone applied to the affected areas as needed for dermatitis. Functional assessment. Patient denies using any recreational drugs or smoking and states that she drinks socially 1 to 2 glasses of wine 2 times a week. Patient does not have a structured exercise program, but is constantly on the go and doing household chores. Patient states she has interrupted sleep due to her shoulder pain. Patient does not follow a strict diet, but states she eats at least 3 to 5 servings of fruits and vegetables each day, along with lean meats, salads, and drinks 2 cups of coffee per day. Patient has no assistive devices. Psychosocial data. Patient lives with her husband in a small town called Robezonia, located in Pennsylvania. She has 3 children, all living 20 minutes within her, and have her families of their own. Patient states that she has excellent relationships with her friends and family, along with them being a tremendous support system. Patient denies any body image issues and claims to have no perceived stressors in her life. Patient is highly involved in her church, attending every Sunday, participating in their activities such as Meals on Wheels and making Easter baskets. Family history. Patient's father and grandfather had strokes. Her mother and grandmother have cardiac illness. Her brother and sister both have diabetes. Her brother had oral cancer, and her niece is an alcoholic. The first system reviewed was musculoskeletal due to patient's chief complaint of right shoulder pain. Subjective data. Patient states she has limited range of motion in her right shoulder, along with pain, crepitus, tingling, and numbness that worsens at night. Patient has muscular weakness in her right shoulder when lifting objects. Everywhere else, patient states is normal. Patient states that there is no pain, deformities, or fractures in her bones. In regards to neuromuscular disorders, patient states she has osteoarthritis and a bunion on her left foot. She has a family history of stroke. Patient states she has difficulty bathing, doing hair, clasping her bra, dressing, and has difficulty doing cleaning and cooking. Patient has no problems communicating. Patient denies having any occupational hazards, exercise programs, or recent weight gain. Patient states she does not smoke and drinks 2 cups of coffee per day, along with 1 to 2 glasses of wine twice a week. Objective data. Patient's limbs are symmetrical and even. She has a smooth and steady gait. Her spine is midline, and her scapulae are even and in line with each other. When assessing and palpating the joints for full range of motion, redness, inflammation, warmth, pain, and crepitus, the right shoulder was the only joint with an issue. The TMJ, neck, elbows, wrists, fingers, hips, knees, ankles, and spine all had full range of motion with no pain, warmth, inflammation, or crepitus upon palpation. The right shoulder had limited range of motion. The right shoulder could only be flexed 45 degrees with assistance. Internal and external rotation could not be done. Patient's muscle strength was normal for the left deltoid, biceps, triceps, wrist, finger, hip, hamstring, quadriceps, and ankle, all being 5 out of 5. The right deltoid, though, was impaired in strength, and the test could not be done due to the patient's impaired range of motion and not being able to flex. The second system reviewed on the patient was the integumentary system due to patient's past history of dermatitis and the recent removal of the basal cell canner. Review of systems. Patient stated that she showered once a day and has no diseases, infections, or lack of oxygen in her skin. Her nutrient intake is considered normal, with plenty of servings of fruits and veggies. Patient states no exposure to chemicals, drugs, or allergic reactants. There is no trauma to the skin. Patient uses a Suave daily moisturizer after showering and uses medication for her dermatitis when needed. Patient is often exposed to the sun, going on multiple beach vacations in the summer and constantly being outside for her grandchildren's sporting events. Patient claims to use 30 SPF sunscreen when going out in the sun, but only started using it as an adult. She states that the skin gets dry during the winter, along with some rashing and itching on the back, arms, and lower legs during the winter. The rash is characterized as red and blotchy, and patient uses betamethasone lotion as needed for the rash. Patient states that she has moles on her back that she gets checked twice a year. Patient states there have been no changes to her nails or hair. Objective data. Patient had good hygiene, there was no odor, and there was no sweating present. There was flaking on the right side of patient's scalp, but no lesions. Patient's hair is white, fairly thin, evenly distributed, and silky. Patient's skin had a pinkish undertone and was uneven in pigmentation, having many moles scattered on her back. Some varicosities were noted when the lower right and left legs were inspected. The skin lacks moisture, is rough, thin, but the same temperature on both sides. There was no edema, there was some turgor, but no denting. Patient's nails had some ridging, they were clean and no dirt underneath, they were attached to the nail bed and have an even and strong shape. Capillary refill was less than 2. Based on an article from the American Diabetes Association, I would also do a head, eyes, ears, nose, and throat exam on patient. This article states that some common symptoms of diabetes include feeling very thirsty, very hungry, and blurred vision. Due to the patient's family history of diabetes, I think it would be important to do this exam to ensure that she is not showing any signs and symptoms of diabetes. In a Lancet article called Hypertension, it talks about how hypertension is the leading contributor to disease and death each year. This article also talks about how hypertension, when not taken care of, can lead to more serious conditions such as stroke and heart failure. Due to the patient's family history of stroke and cardiac illnesses, along with her hypertension, I would definitely do a cardiovascular assessment to ensure that there are no abnormalities and that her heart is working fine and nothing is wrong.